Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and I'm very excited today to have a great guest with us, Dr. Ginger Bratzel, who's a marketer, business strategist, author, and founder and creator of Rio Grande DATP LLC. For over 2 decades, Ginger was in private practice where she developed systems and strategies to increase client attraction and create business growth. From her own success in working with other healthcare professionals, Ginger has become a consultant and coach with one of the largest healthcare marketing companies in the nation for their top level clients. Ginger, thank you so much for being on the podcast today.
Well, thank you for having me. I think we're gonna have a good time here.
Yeah, me too. Well, so, you work with many dental practices, right?
Right.
So how did you get into working with practices in the first place?
Well, I think, as you said, I was in practice myself, and I was real happy just to be there. That's the only thing I wanted to do my whole life, was to be a dentist, and I was just happy doing my thing. And so when I graduated from dental school, I thought just having a degree is all you needed, and people were gonna come. You build it, and they will come. And couldn't be farther from the truth. So, from my own obstacles, which I could talk about for a long time. I went through a lot of crap, and from my own experiences, I picked up some good hard lessons. But it wasn't about how much I knew or how much my degree or how much equipment I had. It was about how I can make that connection to the customer, the patient, the client, what was going on in their head and what they really had those conversations going on. And when I flipped that conversation from what I could do for them to, hey, what do they really need, and talk to them that way, my practice took off. And I was happy to do that and just continue on until I got a call from my accountant telling me I was making too much money, which is a nice call to get, and asked me what I was doing and asked me if I could help other people doing it. So I just kind of fell into it, helping others. And then there would be 2 more, and there'd be 4 more. And it's like, if it worked here, can it work somewhere else in the country or in the world? And it just kind of snowballed from there. So that's all I've done for the last 12 years is I work exclusively with other people in their businesses, their practices, mostly healthcare, mostly dental, and doing that.
Went through some struggles in your practice, it sounds like. And what resonated was shifting the mindset. Correct me if I'm wrong, from looking at their teeth and seeing what can I do for them to saying, what does this person actually want? So like shifting from their perspective, right?
We always as dentists try to educate our patients. You're like, here, let me explain what a crown is, and let me explain what an abutment is. They don't care. They never, ever care. So, if I started really listening to what they're saying and said, I've got a gap here. So if I said, hey, do you have a gap here? I can help you fill that. Or my teeth are yellow and crooked. Not that, hey, do you want veneers? I want a nice smile. I can help you with that. So we're saying the same thing, but we're doing 2 different languages. And so when I put all the dental conversation out and started talking just in their words, all of a sudden, hey, it got to them. It connected, the gears and the little sprockets connected and say, can you really help me on it? And so I was there in their conversations, and they would say yes.
I could not agree more with what you're saying. That I think it's a huge issue in dentistry, where we try to talk to patients and sort of put our knowledge on them versus listening to them and speaking their language. Like I like to say, speaking in a 4th grade language, and only answer questions.
4th or 5th. I was looking at a website yesterday. Someone asked for some help, and they sent me their website, and they had spent a lot of money on this website. And that's the first thing that they just got it, and they thought everything was going to change because of this website. They had like 2/3 of their website dedicated to a dental dictionary explaining every dental term in there. In fact, most dental students need to look at this resource because that's what's going to get them through school. If our patients wanted to know that much, they would be dentists. So don't go there. They're people.
Yeah. Oh my gosh. It's like, can you imagine going to like the BMW website and having a talk about like, piston compression definitions? You're 100% correct. I'm trying to unpack it a little more because I think it's such a large issue in dentistry, right, that I think you went over it very quickly. And I think it's something that dentists and dental teams and people who are running dental practices should really think about. Like, take some pause, have a team meeting, and really talk about how you can communicate at the patient level. I think it's a big, big deal.
I think a lot of people think they're doing it, but what I'll give my clients an assignment, or someone who's, we'll give your listeners assignment. Go through for the next week and write down what they call for as an appointment. Nobody's calling for a veneer. They're calling to get something done. I need my teeth cleaned. And when they say I'm here for a teeth cleaning, don't change that vernacular. You have to use those same words for them, and just everything they say. And so whenever, like, we'll go through on social media, everyone's trying to say, get your prophylaxis or into your insurance. They don't care about those things. You've got to use the words that they're calling in. Yeah, I go into forums a lot of times. I'll give you an example. I had a client that was really good at converting people that came in for dental emergencies, but they weren't getting a lot of dental emergencies. And we were going through and listening to all these things that they were doing, and they weren't using the right vernacular. So we got into a mom forum in their local area, signed up. I'm sitting there just listening to what they're saying. And we had one of their staff members just ask, what do you like about going to the dentist, and what do you hate going about the dentist? And we watched the words come in, and we wrote down word for word, word for word. And so when it came to what we call a dental emergency, they never called it a dental emergency. They called it a bad tooth. Now let's stop and think about it, because that's what marketing is. It's behavior and psychology. A bad tooth puts them off the hook. If I have a dental emergency, it's my neglect. I didn't take care of it unless I got hit by a crowbar. It's something that I put off. But that bad tooth, it wasn't my fault. It was that bad tooth. He just went rogue. He went crazy. And now I need something done about it. And so we changed all their wording on their website, any social media, any advertising they didn't say, do you have a dental emergency? Say, do you have a bad tooth? All of a sudden, all their new patient visits for those emergencies went up, and they got them in the door so they could convert them better, because they were good at that part.
Well, that's, and I want to emphasize, because you're exactly right. Once they're in the door, once they agree to treatment, I mean, and you're talking with them, I think you can explain and talk, because obviously we have to inform people of their, the risks and benefits of all treatment, but we have to start off where they are. I mean, I think your example of a bad tooth versus dental emergency is, because as we all know in dentistry, there's very few true dental emergencies.
Right.
And so then I see, like, on the same forums where people are talking about, like, well, ask them how soon they can get here. And if they don't say they're going to drop everything and get there, it's not a true emergency.
Right.
Well, in their mind, they have a bad tooth, and you're either going to conveniently see them or not. Right. It's not, if you're going to only limit your practice to true dental emergencies, people that are going to leave the office and come to you whenever you can, you're going to have a very small practice, right? If, however, you expand yourselves to see people have bad teeth, it's going to be a much more prosperous practice. I love that analogy. I think it's perfect. So thanks. One of the things we haven't met before, but we were talking, like, in the, right before we started, and I loved what you said about getting massive amounts of phone calls to a practice. Like, a lot of dentists, their dream is to have a bunch of people calling their practice, right?
Right.
And you were kind of like, whoa, let's put the brakes on there. So could you explain why, like, having your phone ring off the hook isn't necessarily a good thing?
So when people come to me, usually, I said, what can I help you with? They said, I need more new patients. So they've diagnosed that's what they need for their practice. And I said, great, let's go through and look at some stuff. And so, if I look, I'll secret call them. I'll ask how quickly I can get in. I'll have someone go in there and find out about the experience. I can find out really quickly. Usually it's not a bunch of new patients they need. It's usually we need to start in the middle. That's the middle of the equation. Let's put it in the middle of the sentence there. It's not the new patients, it's the conversion, it's the systems in between. So for instance, I had one client that wanted a bunch of new patients. She couldn't get anyone in for a month, and a new patient visit took 2 hours to do, and she can only see 2 new patients a month. That is counterproductive. So it's got a system breakdown. There's a management issue. There's a breakdown in the framework. So fixing that first helped her be able to spend less on marketing, because she was able to convert more people. And then she had a better conversion. If I'm going to spend a lot of time and get my phone ringing, I want to make sure most of them stay, and most of them pay, and most of them refer, to make that process all worth it. If not, you're just kind of filling an empty bucket.
Totally. Yeah. The way that I look at it from a business perspective, I know in dentistry, sales is like a dirty word, right?
Yes.
But when you're talking about bringing a patient in and doing something, that means they're buying something from you, which is a sale. And so I look at it as, there's 3 parts of what you discussed here. There's marketing to get people to your practice. There's the sales conversion of you're convincing them to do something. And then there's delivery of care. And if you can't deliver the care, or if the person's always saying no, makes no sense to have more people call your office. Does that make sense to you? Is that?
That's it. And it's easier, to clean up, and it's cheaper to clean up the systems in between. It's a lot more economical, better return on investment than to spend a lot of money on marketing. And again, I'm a marketing person, but we never start there. We always got to get that situated right at the beginning.
If you have the other systems developed, you don't need as many people coming in the front.
That's right. That's one thing with her. She wasn't really doing her same day dentistry. They had all this meat on the bone there, and she was so worried about getting a new steak. I'm like, hold on. And so profitability went up a lot better. Her stress level went down considerably because she wasn't having to see a lot of new patients. And then, she wasn't forced with a huge number of team members she was looking to add to accommodate these patients she couldn't even treat. So it was just a never-ending cycle until we kind of pulled it apart and look at what the true problem was, fix that first, and then spread out from there.
So if that's like the number one thing that you see dentists sort of where they could improve is like not focusing on the systems before they focus on the marketing ahead of time. What would be another big thing that dentists can do to help improve their efforts?
Well, I tell all my clients too, if you're looking for professional growth, you're not willing to do personal growth first, it's not going to happen. And so a lot of these things, like in this one situation I just told you, I see it over and over. We've got some preconceived ideas that we just can't get over. And so we need to open ourselves up. Hey, maybe there's another way to do it. I think that was one of my big problems too. When I started in practice, I was looking at everyone in dentistry and said, that's the way you have to do it. And when I started looking outside of dentistry and other businesses that didn't have that same notion, didn't have that same thinking pattern, it's like, well, how come they can do it and I can't? We look at drive-up windows and bank windows came out of that same thinking that translated across someone looking across industries. And so don't be afraid to look at other businesses and see how you can adapt it. And right now with COVID, after everything, a lot of the stuff we thought you had to do in dentistry and had to be that way got thrown in the trash can because of need. And so we can rethink of how we run practices and how efficient we run things and how systems are set up. So it gave us an opportunity to rethink what is really true and what we believe to be true.
Yeah, I agree. I mean, that's a drum that I beat hard every day. And I don't think, I would say that it's not something that gives us the opportunity. I think it's a necessity today. I think that, their patients, in addition to our team members who sat home for a couple months and were like, well, gee, I don't need to go back to work there if I don't want to. Mm-hmm. Our patients are like, well, I don't need to go back there for dental care anymore. Right. And they're seeking out the people that are actively positioning their practice to address exactly what you talked about. If you go to Starbucks and have a much better experience than your dental practice, we are doing something wrong. Right.
Well, that's our competition. You think about it. It's, they're looking at the neighbor down the street. They're looking at Amazon. Like I can get it here today or tomorrow. They make it convenient. So, when people have limited hours, they close early, they stay open late. That is not going to accommodate what our consumers want now. And so we keep forcing them in this model, and they're voting with their dollars, and they're going somewhere else.
Couldn't agree more. That's completely this. We're aligned in perspective on kind of where the industry, I think, needs to go if we want to do what our job is, which is to elevate people's oral health. We need to meet people where they are. Right. So thank you very much. Where can people go to find out more information and to reach out to you?
Sure. When we're talking about getting patients and everyone's looking at new patients and things like that, I think one of the biggest resources you can use is your existing patients, just like your existing system. And I think there's some gold mines in your own practice that you might not be quite aware of or fully developed. So when people come to me and they want to find more new patients, I say, hey, let's look at your golden patients first. So I have a checklist, a little worksheet to help you work through that process, to give you some ideas so you can kickstart and getting more patients in your practice and keeping more patients. And you can reach that over on my website. It's over at Ginger Bratzel, my first and last name, .com/patients.
Great. Well, thank you very much, Dr. Ginger, for being on the Patient First podcast. Very much appreciated.
Thank you so much for having me.